Namaskaram. Welcome to Geeta Kollipara podcast. This is your host Geeta. Today's episode is something many of us can deeply relate to headaches. They are often brushed aside as something minor, might be stress or just lack of sleep. But what if these small recurring headaches are actually signals from our body asking for attention? To help us understand this better, I am joined by Dr. Ravi Krishna Kanth, a consultant neurophysician at NRI Hospital, Chinnakakani, and Vijaya Super Specialty Hospitals, Vijayawada. Hello, doctor.
Hi Geeta, very happy to join you today, and I wish you best for your upcoming podcast and whatever plans and endeavors you have decided in future too. Right. Today we will discuss about headache and which is disabling for most of our younger generations, and it is a common complaint that I frequently encounter during my OPDs, either any hospital, wherever we stay. It is the commonest complaint that we often get. So definitely it requires some attention.
Definitely, doctor. Completely agree with you. In our daily life, what are the most common triggers of headaches and which ones are often we overlook?
Yeah. So before I explain you about the triggering factors. First, I would like to make you enlighten regarding the types of headache that we should be aware of. So, in that, the first thing is, so you have to understand that brain per se, the brain tissue, the parenchyma or the tissue, is pain insensitive. So, brain is never pain structure. But what will cause headache is the surrounding structures of the brain. What we say the dural vessels, dural tissue which covers the brain, and also the blood vessels which supply the brain tissue. So they are the pain sensitive structures. So anything that causes irritation to these structures, the dura, that is the covering of the brain, or the blood vessels, that will trigger the headache, and that will be more disabling for any of us. So if anything that triggers these structures, pain sensitive structures, we say it as a secondary headache. So if you don't have any etiology that triggers or any cause that triggers the structures of the pain sensitive structures, what I said, the dura or the blood vessel, so then you say it as a primary headache. So the primary headaches are the vascular headaches, where you see the migraine or the tension type or the trigeminal neuralgia. All of these three will have the common triggers being you which younger generation keep on getting, like dehydration and sleep deprivation and stress. Other factors like if you keep having too much of caffeine, too much of medication overuse, and alcohol consumption, and also like drug abuse and some substance abuses if we have. So these are the things that keep on triggering the migraine or the tension type headache, which are the primary headaches. When you come to the secondary headaches, which I have told that which irritates the surrounding structures of the brain, that is dura and the blood vessels. So in secondary headaches, the chronic irritation, it can be because of infection, or it can be because of any of the inflammation, or that irritates the structures, and also tumors. So any of the tumors, or if you have any chronic structural etiology.
Thank you so much for taking time and explaining in detail. How do these occasional headaches progress into chronic conditions over time?
Yeah. So chronicity, if you see about a thing called chronicity, so we define it as a chronic headache when you have this headache is recurring, like you say the attacks of approximately like 15 days a month for approximately 3 consecutive months. It is categorically described in migraine when you say the recurrences are like every alternate day for per a month, and this happens every 3 months. So similarly, you also have any headache, that like tension type of headache, who is like not having sleep, who is not having meals, who is taking too much of stress, and who are using other drugs. So this tension type of headache will also be defined as chronic when you have it beyond 3 months. So whenever you have it, the headache, please give attention immediately, and you should know what type of headache you are having. You have to understand that, and when you are not able to manage it by single painkiller or single analgesic at once, then please go and visit a neurophysician. Then only you will be able to know what problem exactly is happening. So before, don't keep on using continuously long standing analgesics or pain relief medications over the counter for your headaches without knowing the etiology. This is very much important.
Thank you so much, doctor. So, beyond migraines, what are the type of headaches that are becoming very common, especially with the younger generations?
Yeah. So if you know, right now, the youngsters, the particularly the female sections of the youngsters, the younger group, might be because of the food habits that we have, or might be some amount of lifestyle changes that we have in the current generation, because these food habits and lifestyle changes have increased incidence of the menstrual disturbances in females, and also the PCOS problem, which is very drastical increase in incidence compared to the prior decades, which we have been observing. So the polycystic ovarian disease and the menstrual irregularities which they have been suffering, so they keep going visiting the gynecologist and they start using hormonal pills. So once you start these hormonal pills, also patients who take infertility treatment for ovulation induction or some other contraceptive pills. So people who use this infertility treatment and hormonal pills, so they have the tendency to develop the pressure related changes in the brain. So normally, apart from the brain, and I also told you the structures that surround the brain, that is pain sensitive, which is dura and the blood vessels, and you also have the normal CSF. So CSF is the cerebrospinal fluid, which is a fluid inside the brain tissue, which is necessary for all of us for the natural functioning of the brain. So it is like approximately you have like 150 ml per day. It has the natural CSF fluid will be 150 ml, and also the pressure will be approximately 20 centimeters of the water. So this pressure keeps increasing when you are on these hormonal pills, and when you gain weight abruptly, like over a span of 3 months or 6 months, we keep observing like they gain weight of 10 kgs, particularly postpartum when you deliver a baby, and sometimes when you use medications, for example steroids, for some other reason, and also people who are on hypervitaminosis, like some have a habit of using too much of unnecessary vitamins, so vitamin A particularly. So all these vitaminoids can also cause this increase in pressure of the CSF, which we say IIH. So this is a type of headache where we call it as idiopathic intracranial hypertension. So this is a little longer term, but to simplify it, I just told that it is because of increase in the pressure in the head, the CSF pressure. So to avoid this, you should always be cautious about the pills what you use for your menstrual disturbances and the duration of the pills what you use. Also, you should be aware, is it seriously required, and how long, apart from how long, you should keep monitoring whenever, after a timeline of 6 to 8 months, if you are having a headache, please do consult neurophysician. And it usually presents, say for example, I will describe if the how does this differ from migraine. So it usually presents like they come with visual disturbances completely. Doctor, I'm not able to see the vision clearly. I'm having blurring of vision, and I'm having early morning headaches with sleep disturbing, and they often have oral fullness, the tinnitus, some ringing sensation in the ears. So whenever you have this history of ear fullness, visual blurring, and early morning headache, when you wake up from bed, immediately you are having daily, and you have history of pill usage, please do consult neurophysician, and they are the right persons to judge what type of headache again you are having.
Thank you so much, doctor, because we don't even think about whenever we somebody is going through fertility treatments or anything, we cannot correlate the headaches with what the medication we are using. So this is really really informative, and I think all our audience will definitely benefit from this particular conversation that we are having. Doctor, just to go back to the previous question, previous discussion that you are mentioning in regards to painkillers, what are the risks of relying on painkillers frequently? I mean, without addressing the root cause. So, what are the risks?
So, okay, you in India and of course in US, whatever the country you have. So, in general, over the counter you get acetaminophen or the paracetamol. So, paracetamol is like, it's a simple medication which you get very cheap and you can buy and you can use it left and right. So, this paracetamol or acetaminophen uh, is relatively safe, supposed to be safe for a simple headache. Say, for example, when you have an acute dehydration, where or when you skipped meals, you are in fasting, and you are stressed out, and you have sleep deprivation. All these small triggers, or you had a fever, which simple viral infection could have precipitated your headache. So for these things, paracetamol is simplest best medication that you can use. There is no problem in that, but provided it should be in a limited quantity. So toxic doses are when you use more than 4 per day. This is one thing that you should remember, that you only use 2 per day. I suggest not beyond that. And if it is not subsiding, like you can't use like for days together and weeks together. So you have to approach the physician, and is it seriously warning or is it seriously alarming and disturbing? Then you should get the imaging done from the physician. Then before that, apart from acetaminophen, people also often use in India NSAIDs. So over the counter we get here naproxen. We have many other medications, indomethacin, which are very harmful for your stomach as well as kidney. So first thing it causes, if you take too much of these, it will cause gastritis, where you have pain in the abdomen, pain in the stomach, bloating sensation, and vomitings and nausea. All these things can happen. The next thing, if you keep neglecting and you keep on using this naproxen, there is again higher incidence of kidney issues. So the renal dysfunction starts sets in, and we have very common people who who have developed chronic kidney diseases because of this excessive usage of NSAIDs. So you should be aware of this unnecessary NSAID usage, and please don't use NSAIDs too much. Also, apart from kidney and stomach, so you also have medication overuse headache. So if people keep on using opioids and barbiturates and benzodiazepines, they have for some other pain, and some people keep abusing it for some other reasons. So please don't make your headache as a chronic headache into a medication overuse headache, which is more difficult to treat for any neurophysician, to make them wean off these medications and medication overuse and medication toxicity. So please don't take yourself over the counter whatever you get and for how long duration you want.
That's very important to know, especially since many people try to manage on their own. When should someone stop self managing and seek medical attention? As
Yeah, so here I would like to tell, you should know or you should be aware of some warning signs. Okay, so where you see particularly headaches with change in posture. For example, if a patient for a person is having headache which is not subsiding with, and it is progressing in intensity and also in severity. So, for example, yesterday you took a paracetamol and it subsided and it lasted for 3 hours. Today you are having headache for 6 hours and it is not subsiding with paracetamol, and you started to have vomitings, as well as if you start to have vision disturbances. So these are the red flags where you have vision disturbances and some focal deficit. In that way, I would like to tell you focal deficits. in scientific way what we say. In simpler way to understand, I would like to tell, like if you have speech disturbances, stammering, and if you also have an associated, if someone told you that there is deviation of your angle of the mouth, or you have some difficulty in gripping of the objects, or you have some gait disturbances, you are not able to walk like the usual way you see. So these are the alarming signs that you should be aware that you have to go to the neurophysician at the earliest possible, where a simple stroke or a long-standing tumor which you would have missed. So these all the things that you should be aware that which these are the signs for us that there is some pressure changes also happening in the brain. So you should be immediately reaching the physician as soon as you have these symptoms. Also, the other pictures, like if you have a fever followed by headache, which is not subsiding for weeks beyond, and if you have constitutional symptoms like you are having weight loss, you are having decreased appetite, and you are having some sensorium disturbances, like you are not knowing what's happening sometimes, what is happening surrounding you, and some behavior changes. If someone is pointing out that you have significant change in behavior, so then your work efficiency is getting decreased. And there are also changes like some hemostasis changes. For example, people who are overweight and who have wide neck, like BMI more than 35 and neck circumference is also huge, so those patients will have a tendency of OSA, like obstructive sleep apnea, where you see the tongue falling back and excessive snoring. So in those patients also you have like carbon dioxide retention. Normally, the whatever the oxygen carbon dioxide levels that should be in the brain, so or the blood, normal carbon dioxide and oxygen levels in the blood. If it is not maintaining, and these changes happen because of the sleep apnea, so that will also cause the early morning headache. So you should be aware that these changes of excessive snoring and sleep disturbances, also the lifestyle changes what you are facing recently that have come into your life. So these are the things that one should be aware to approach physician earliest possible.
Thank you so much. And once they do see a doctor, at what point are scans recommended and what types of scans are typically used?
Okay. So next biggest problem for any neurophysician is, so any patient comes to the OPD, they keep asking patient, doc, do I need a scan? Doc, please get me scanned done immediately. So a scan is something that you should not abuse it, because if you say CT scan, you should keep in mind that one CT scan is equal to 700 X-ray radiation exposure. So after knowing this from Google or AI, now people started asking, "Sir, I don't want CT. Please get an MRI image done because there is no radiation. Please get it is anyway not harm, no. So please get me immediately the MR done." So you should be aware that even MR to get done, we have specific recommendations and specific warning signs to get imaging done. Even simple headache, but headache, if you have like age group of more than 50, if you have a head injury, a recent head injury, and if you have an altered sensorium, like you're not obeying commands and you are not communicating properly, you have speech disturbances and you're in semi comatose state, and if you have any other like what I've said, constitutional disturbances or a focal deficits like earlier. Apart from that, if you have a loss of consciousness episodes like repeated passing outs, and if you have episodes of seizures which were noticed by recent by your bystander or all any of your family members, so you should know that any of the raised ICP features or raised intracranial pressure features, or if you have a warning signs of focal deficits, then only it is scan is immediately required. So if you suspect a stroke, if we suspect a stroke, and we should be aware that in stroke we have an injection of thrombolysis we do within 4.5 hours. In those patients, we prefer to get CT earliest possible to thrombolize easily. So if you are not suspecting stroke or a tumor, it is always get we always suggest an MRI done, where you have for chronic conditions for better exposure. And if you have structural pathology in that, we also suggest an invasive angiogram or a contrast imaging if required. Please, patient should not decide whether he has to get imaging done or not. You should be aware that doc will examine, doc will take your history properly, and then he will correlate and he will he's the person, he's the best person who will decide that whether you need a CT scan or an MR done or a contrast MR done. So please give him enough time and space. And whenever definitely there is warning sign, no physician will hesitate to get a image done.
Yes, definitely, definitely. Thank you. Thank you so much. Finally, for our listeners who want to take control of their health, are there any lifestyle changes that can significantly reduce the frequency or severity of the headaches?
In your last question, I would like to tell that so the commoner headache, leave about the tumor or an idiopathic intracranial hypertension or some abnormal things that happen in the brain. So the commoner simple things are the migraine and tension type of headache, which see if you migraine, if you ask, there is 10% or 20% based on some studies, say 10 and 20%. In the sense, lifetime prevalence of any person will have in an year, they will have 10 to 20% chances of headache of migraine type or a tension type of headache. So those people, for all of us, should be aware that we should not skip meals. We should have timely food which is required, and also you should have sleep hygiene is the utmost priority. So though we suggest for migraine 8 hours of sleep, in the current scenario we can guess that sleep is very much disturbed for all of us. So please make sure that you have at least 6.5 to 7 hours a minimum sound sleep, which is very much required for your brain health. It's not only for a headache, it's also for your memory, that is important. And other things is like screen usage. So biggest challenge for all headaches to manage is screen usage. So your screen time should be minimized as much as possible. For software professional or IT professionals, I would like to tell that you have to take adequate screen pauses, like 15 minutes once in 2 to 3 hours, and just have a walk in between and get back to your work, which makes a lot of difference for your headaches. Also, avoid screen usage prior to sleep. I would like to tell that 3 hours before you should stop eating, 2 hours before you should stop taking too much of exercise, and 1 hour before at least you stop all your devices. So then only your sleep hygiene will improve. So this 3-2-1 rule you keep applying for your lifestyle so that your sleep is also adequate. Now taking stress. So taking stress will cause too much of adrenaline, noradrenaline, hormonal surges, cortisol surges, which will also which will also make your sleep disturbed. So please take mind relaxation exercises, also physical exertion in the early mornings, so that your cortisol surges will be under control. And also mind relaxation in the sense you can use the way like you go either spiritual way, or you can use meditation, yoga, pranayama, or the deep breathing exercises. All these have proven benefit so in decreasing the frequency and severity of the medication, also medications as well as headache intensity. So apart from this, the most other important thing is eating habits. So in eating habits, you should choose like first stop using alcohol and cut down your addictions. If you are on addictions, unnecessary medications, if not required, please stop using them. And also caffeine toxicity. The more commoner things which we face this challenge is caffeine toxicity. So please stop using excessive caffeine, and one cup of coffee during your headache will make a lot of difference. Also, use of dark chocolate. You can consume dark chocolate, but not too many chocolates that will make your headache trigger. Dark chocolate is good for your migraine headaches. Okay, and also fresh fruits and vegetables which contain antioxidants. So antioxidants and omega 3 containing foods like flax seeds and also pumpkin seeds. and dry fruits like walnuts and berries. So all these fresh fruits and vegetables, antioxidant containing food, will help a lot in your brain health as well as decreasing the headache severity. So get all these things done, and whenever you get an headache which is worsening in character and alarming signs are present, please do consult neurophysician at the earliest possible before taking a self prescription or self medication.
Thank you so much. I hope the insights from today's episode help you find relief and clarity and guide you one step closer to harmony and happiness. Thank you. Signing off, Geeta. Namaskaram.